Hello everyone, today I'm going to explain the brow lift procedure for individuals who want to transform their facial appearance from masculine to feminine. This surgery is more complex than typical brow lift that is done for rejuvenation or to correct drooping eyelids. For transgender patients, the goal of the brow lift is to elevate naturally low masculine brows into a higher, more feminine position, creating a gentle and natural arch that gives the face a softer and more feminine expression. In cases where the patient has a prominent brow bone, I always recommend performing a frontal bone reduction together with the brow lift. Without reducing the brow bone bossing, a brow lift alone cannot create a truly feminine appearance because the prominent brow ridge is one of the strongest masculine features. It also reduces the distance between the eyebrow and the upper eyelid, which is normally much closer in men compared to women. When we classify brow lift techniques based on incision design, they can generally be divided into three main approaches. 1. Coronal incision at the anterior hairline. This is the technique I recommend as it allows lifting the brows without pulling the hairline backward, helping maintain a feminine facial proportion. 2. Coronal incision behind the hairline within the scalp. This approach hides the scalp very well, but the downside is that the hairline will be pulled higher, making the forehead look longer and more masculine. 3. Endoscopic brow lift. This minimal invasive technique avoids a long coronal incision, but it also tends to pull the hairline upward, which is not desirable for feminization. For brow feminization, the lifting vector is extremely important. The correct direction is a superolateral lift, meaning we elevate the brows diagonally upward toward the sides. This helps create a higher tail of the brow and form a soft, natural feminine arch, with the highest point located around 2/3 of the brow. On the other hand, a straight vertical lift is not suitable for facial feminization because it creates a shape that looks less feminine and may even give a surprise or unnatural expression. In many patients, the eyebrows are naturally uneven before surgery. A brow lift also allows me to adjust and improve the symmetry of both sides so that the brows appears more balanced. Everything I explained today represents a key principles of performing a brow lift as part of facial feminization. We must carefully evaluate the brow bone, the hairline, select the correct lifting technique, and adjust the symmetry to achieve the most natural feminine result possible.